All right, good afternoon, everybody. Thanks for being here, and I just want to say a few words thanking Dr. Alexander Scott, for her efforts, and I'll say a few words and then I'll hand over the microphone to her. But I just want to point out that Rhode Islanders should be very encouraged by the progress that our state has made on vaccinations over the last week. And again, thank Dr. Alexander Scott, General Callahan for their dedication through the pandemic and particularly over the last few weeks to get the distribution and the vaccines into the arms of the people of Rhode Island. So as a incoming team, merging with a current team, we've taken new steps, getting vaccines out of inventory and into the arms, building out capacity at the state's sites, and engaging municipal leaders in the vaccine rollout for Rhode Islanders over 75 and older in the municipalities. And as a result, thousands of shots went into arms in our state in the last week. We know much more needs to be done, but getting more shots into arms right now will get kids back to school, get people back to work, and get us back to normal. So there's more good news. We learned this week that the state of Rhode Island is receiving a grant of more than $64 million from FEMA to help cover associated cost COVID-19 vaccine distribution efforts. This will help in our efforts to speed up the vaccine distribution for Rhode Islanders, helping on both state cost and also municipal cost. So one of the best ways that we can speed up the distribution is to create capacity. And that's what we've been working on for the last few weeks, and we'll continue over the next weeks to build that capacity so we can deliver more vaccine as the supplies come in. I was on a call this week with the White House, with governors throughout the country, and they are ratcheting up the supply, 1 million more doses this week, 2 million doses next week, and with Johnson & Johnston, that's what's being projected, if not next week, soon after that. So the supply is continuing, and I think that's really important. So that's why increasing the sites, both state sites and municipal regional sites, builds out the capacity in advance of the supply so that we can quickly get shots into the arms of people throughout the state of Rhode Island. So we need our cities and town leaders, and we've been working with them over the last 4 weeks and engaging them. And I visited sites now in Portsmouth, East Providence, Pawtucket, Central Falls, my hometown of Cumberland, Johnston. I've also visited the state sites in Cranston, at the Dunk Center. We are building out the capacity to meet the demand when the vaccines inventory continues and increases. So we want our cities and towns to operate the way they are right now, but the model that Dr. Alexander Scott will talk about is at 5 different state sites. As we get the municipal regional sites set up, they will move from their local sites into those municipal sites, those municipal regional sites, and again, continue to build the capacity. And things that we've worked on, one step that I've worked on is make sure that we can get more and more people eligible to give the shots, so to allow EMTs, advanced EMTs, to administer the COVID-19 vaccine. This, again, builds up our capacity to make sure that the people who are qualified are there for us to make sure that more and more shots get into arms. So I would just say one more thing on the municipalities and the importance there as they shift from their sites to the municipal regional sites that will be set up. We need to really continue to work on the fact that we need to buy in that people get their shots. Because the goal is to reach 70-75% of the state's population, and we're going to need municipal leaders and local civic organizations, and we're going to continue to work with them to make that happen. So I just talked to the people of Rhode Island, some of the things that I've been working on for certainty in terms of contacting. I have had a phone call with the Governor Ned Lamont in Connecticut, had discussions with Dean Graham Allison at the Kennedy School, who are now, providing information about how states are doing on the rollout of the vaccination. And that's all important information and backdrop to the work that we're doing. So earlier this week, I also participated in the call I said with the White House. In addition to that, I want Rhode Islanders to know that this transition continues in a way that is going to keep them safe. And transition is accelerating, as you can see in the media right now, that things seem to be working out in terms of the Senate, in terms of the confirmation hearings that soon to be set. So the theme, again, continues to be right now is that we want to make sure that people get vaccinated. We want them to stay safe. We also want to get teachers back into the classrooms. And so when I become governor, there will be a plan to get teachers and related personnel vaccinated, because we need to make sure that we get the schools open. And we're working on that right now with the advisory group that I put together, and we'll have some sort of a really strong plan and match that what's happened in Connecticut recently and states around the country that see that as a priority. So I'll leave it at that. I'll be here for answer questions. And Dr. Alexander Scott, the podium's yours.
Thank you. Good afternoon, everyone. Thank you for those updates, Lieutenant Governor McKee. If you can please post our data overview on the screen, viewers will be able to see that our numbers continue to trend in a very good direction. We had 387 new cases yesterday. That's out of 20,545 tests. And that's a percent positivity of 1.9%. Being able to stand here and report a percent positivity under 2%, which is less than half of our 5% target, is excellent news. We have 163 people currently hospitalized. This number has been steadily falling since early December. We have now seen a 65% decrease in our daily hospitalization between January and February, and this compares to the national average of 45% in decreases in hospital admissions. As you can see on the hospitalization slide on the screen now, this decrease in Rhode Island has far surpassed what other states are seeing, and it far surpasses the national average. It's again what our focus was for phase one in being more strategic so that we could have these types of outcomes that allow us to take steps as we go forward. Because our data are generally trending in a good direction, for example, we announced on Monday the suspension of patient care at our 2 alternate hospital sites, with a huge thank you to our teams at Lifespan and Care New England. In addition to the shift we're making with our alternate hospital sites, the improvements in our data are also allowing us to ease some restrictions when it comes to sports. Director Janet Coit is going to say a few words about that, and I'm pleased to have both Director Coit and Secretary Pryor up here with us. But first, let's go further into our data. Our decreases in hospitalizations are being driven by even greater decreases in the groups we focused on for the first portion of our targeted vaccination campaign, such as nursing home residents and healthcare workers. That's an important message as we look at what we have achieved. It's important to know that there are a lot of factors in play. As I've said, between testing, treatment, and vaccinations, we know testing is critical. It's how we get ahead of potential clusters of cases by identifying them before they start to spread. And we're making great results with treatment in our highest risk patients. But there is no doubt that our approach to vaccination is working. We accomplished what we needed to for phase one, and we are well on our way in phase two. There's a natural lag in our fatality data compared to our case data and hospitalization data. We have seen decreases in our fatality data lately, but expect those decreases to follow the sharper downward trajectory of our case numbers and hospitalization numbers very soon, as that lag tends to occur. Sadly, we have 10 new COVID-19 associated fatalities to report today. Our hearts and condolences go out to all of the families who have been impacted. Shifting gears to our vaccination campaign overall, since making the transition to a primarily age-based vaccination approach last week, as the Lieutenant Governor has mentioned, we have made some great progress. Similar to what I outlined last Thursday, we started this campaign by taking a very deliberate, targeted approach to vaccinating. And as I outlined last Thursday, we have plans to get faster and simpler. And that's exactly what we're doing. Last Thursday, people who are 75 and older started getting vaccinated at our 2 state-run vaccination sites at the Dunkin' Donuts Center in Providence and Sockanosset Cross Road in Cranston. And on Monday of this week, we opened scheduling to people 65 years of age and older. Since then, we have made more than 40,000 appointments for those 2 sites through March 10th. And we have administered more than 20,000 shots there in the last week. When you look at the last 7 days, our vaccine administration rate has increased by 130% compared to what we were doing in January over a 7-day average. We're now administering more than 6,600 doses a day throughout the state, which is a great pace and what we're looking to increase even further. All told, we've administered more than 225,000 doses of vaccine since the start of the vaccination campaign. Our work isn't done. We have hundreds of thousands more doses to administer, and we are going to do it quickly. We've come a long way in a short time, and it's important to acknowledge what our team has accomplished with the energy to keep going forward. To our older adults who are hearing about these 2 mass vaccination sites but have not been vaccinated yet, I want to assure you that we are very well organized in these locations, and it is very accessible for you as well to get vaccinated there. At the Dunkin' Donuts Center, there are ambassadors meeting older adults in the parking garage and using golf carts to bring people with mobility issues to the vaccination area. At Sockanosset, there are ramps at the entrances and exits, and both locations have extra wheelchairs and staff to help people move through the sites if help is needed. One other note I want to make for everyone getting vaccinated at the Dunk or Sockanosset: please do not stay in the parking area or arrive in the parking area any earlier than 15 minutes before the time of your appointment. General Callahan was updating our leadership team this morning, and he said that our throughput at the 2 sites is roughly 300 people getting vaccinated per hour. We have a very carefully planned operation in place to get people moving through the system safely and efficiently. But that operation gets complicated when we have lines of people who are on site before they are supposed to be. So again, please do not arrive in the parking area any earlier than 15 minutes before your appointment time. We will be ready for you at the time when your appointment is scheduled, and you can be confident in that. We're going to be replicating the model that we have at these 2 sites at other places in Rhode Island. In the coming weeks, we are planning to open 2 new state-run vaccination sites, one in Middletown and one in Woonsocket. The Middletown site will be located where the Benny's used to be, and the Woonsocket site will be located at the corner of Mendon Road and Diamond Hill Road, where the Sears department store was previously. True Rhode Island style of location. People will be able to register for appointments at these sites the way they can currently register for the Dunk and Sockanosset. It's either by going to www.vaccinateri.org or by calling 844-930-1779. We're also taking steps to ensure that we are getting vaccine to Rhode Islanders who cannot leave their homes. To do that, we've created a form that people can fill out if they are homebound. To be clear, this is not a vaccination registration form, but this is a form to collect information for our planning and implementation. There is a link to the form at covid.ri.gov/vaccination. It can also be filled out by a healthcare provider or a family caregiver of someone who is homebound. As we collect that information, and as soon as we're ready, we'll be able to engage and make sure that important community is vaccinated. Before passing things to Director Coit, I would be remiss if I didn't remark on the fact that we are coming up on the 1-year anniversary of our first case in Rhode Island. 1 year ago Monday, on March 1st, 2020, we announced that Dr. Eva King and her team at our Rideau State Health Laboratories had identified Rhode Island's first presumptive positive case of COVID-19. Between then and now, we have had quite the journey. We have lost more than 2,400 cherished Rhode Islanders. Almost 9,000 Rhode Islanders have been admitted to the hospital because of COVID-19. And every single person in our state has been affected by this pandemic. I want to personally thank all the healthcare workers and members of our COVID-19 response team for their tremendous sacrifices, commitment, and relentless work over the last 12 months. So many of you have worked around the clock for months on end. Many may be exhausted, but are still doing it, still coming into work, still serving Rhode Islanders day after day. We are so appreciative for all that you have given over the last year. I also want to thank everyone throughout Rhode Island. We have asked you time and time again to make sacrifices that we never envisioned asking people to make. This has been a year of loss and a year of testing our strength for us all. We've lost loved ones, we've lost time with family and friends. This year has caused economic hardships and emotional hardships and so many challenges. This was the most difficult year for many of us. But we have also a lot to be proud of as a state when we look back at the last 12 months. The definition of resilience, the partnership and cooperation that so many of you have responded with over the past year has truly prevented many additional cases and prevented so much more of the loss that could have happened. Let's make sure that we don't forget that and that we're able to use that to energize us to get through the remainder of this fight together. With that, I'll pass it off to my colleague, Director Coit.
Good afternoon. Thank you, Lieutenant Governor McKee. Thank you, Dr. Alexander Scott, for your words today and for your amazing leadership over the past year, and your team at Rideau, who have been working around the clock 7 days a week for the past year. They're amazing. Today, I'm making several announcements related to sports in Rhode Island. First, the state will now begin to allow games and competitions for higher risk sports that are played outdoors, such as football and lacrosse. That means, for instance, that the participating high schools in the Rhode Island Interscholastic League will be able to play football during what they're calling their Fall 2 season, which began with conditioning and practice early this week. It means that schools and leagues can plan to play boys lacrosse this spring. To be clear, these sports are being played with COVID-19 modifications. So while we're able to open up more opportunities, athletes will be playing with masks, with sanitized equipment, with other measures that have been where we're taking the best practices that we've learned over time and applying them to these sports. The Interscholastic League of Rhode Island has been fantastic at reviewing what's happened to date, talking to sports medicine experts, and putting modifications in place that make these sports safer for the athletes and their families, for the coaches and the officials and the schools. Second, new rules will allow Rhode Island teams to play out-of-state teams for moderate risk sports in Rhode Island and lower risk sports, as well as for higher risk sports played outside. Related, the teams from neighboring states may use the Rhode Island sports facilities, but in all cases, any teams from out of state have to be coming from states that are on the list where their positivity rates are lower than 5%, and they must be following all of our travel restrictions. Third, with regard to spectators at outdoor events, those rules, consistent with the indoor facilities, will allow people to watch events if the facility or host can maintain occupancy at 1 person per 125 square feet or a 40% capacity. Who can attend? It still remains for youth sports only family members. For colleges and universities, we've been working with these institutes of higher education on a plan for just their home team, students, personnel, and faculty to attend the home games, trying to continue the bubble, the testing, the protocols that are in place to keep students safe. Again, high schools, municipalities, facilities may have more restrictive rules and may limit spectators more, but this gives a opportunity for people to watch games outdoors. There are no perfect decisions, and as the Lieutenant Governor and I were just saying, there's no playbook for this pandemic. I am happy that we're offering some hope. Dr. Alexander Scott just went over more encouraging numbers. Spring is in the air. The opportunity for kids to play healthy activities and do sports outdoors is so vitally important to their well-being. We've seen higher rates of depression and anxiety, and allowing sports and healthy activities, in some cases, even keeps kids in school. I saw how much it mattered to my 2 children when they played high school sports, and I'm really pleased with all of the sober and somber news to be able to offer some good news today. I know this matters particularly for high school seniors, many of whom may have the last opportunity to play organized sports at their school. So finally, I want to again emphasize the leadership of the Interscholastic League, Mike Lunny, Tom Marcello, the principals and athletic directors who have worked so hard to impose restrictions and have worked with the health department on the various protocols and quarantine measures to allow for a successful sports season. And now I will open it up to questions, but turn it back to Lieutenant Governor and Dr. Alexander Scott, and I'll be available if there's questions on sports.
Governor, you criticized the rollout last. Governor, you criticized the rollout last week. Are you now on board? Have your concerns and criticisms been allayed at all? Are you now fine being associated with this plan?
Yeah, I made strong recommendations last week. I think everybody read those, and I think that there's been a response to those in terms of not only what the state had planned, but I think that we're certainly adding the capacity, and that's what I'm most concerned about, is the capacity in advance of getting the vaccines. So it's a team approach, right? State, local communities are now engaged in a way. We've had several meetings with all 39 cities and towns, their CEOs, and I think they fully understand. I think the news today about that $64 million from FEMA is going to make it even more possible for, to local communities to participate. They're going to continue to keep their local units open as they are. It wasn't mentioned, but thousands of vaccines went out this week in addition to what was at the state site and local sites. And then once we open up the regional sites for municipalities, there's going to be partnerships with the municipalities. So yes, I think that many strong recommendations that I've made, I think that were in the works or they weren't in the works, but we're in a good place today, as Dr. Alexander Scott said. We did identify that there was, tens of thousands of vaccines in inventory, and you just heard that those are out in people's arms right now, and that's what we want to make sure happens.
Do you think it sent the wrong message or a mixed message to criticize the plan and then not come last week?
No, so remember, the people know that my time is valuable right now, right? Not only are we working through a health crisis, but we're working through a budget crisis. Yes, last week I spent time on the budget crisis. I certainly made comments before that meeting that, those strong recommendations. So, no, there's no mixed message. The message is that we're balancing many different issues, and time is valuable, and I spent my time last week at budget issues.
Governor McKee, you mentioned the schools. Now, Governor Baker has committed April 1st, he would like all the schools in Massachusetts back 5 days a week. Are you leaning towards that? Will Rhode Island mirror Massachusetts in that effort?
Well, I think it's premature to say where I am, but I did mention that we'll have a plan once I am governor to make sure that the teachers and the child care people who are working with young people that we need to activate, as long as all the school personnel. We're a little late in that game right now. I think that virtually every state in the country has some plan for the teachers. We're going to come out with a plan on that, and then we'll look at Governor Baker's model. And like I just said, I just got off the phone with Governor Lamont in Connecticut, who just made that announcement last week, and we're going to dig into the policy that he put forward as well.
Now, I just want to follow up. The New York Times had a story saying that Governor Raimondo basically had the blueprint for how it should be done. She would call out certain districts, Warwick, Pawtucket, if they were not going back into school. I think in the past you said maybe it would be a local decision, but are you leaning towards more that the state should be the driver? Say, like Pawtucket, parents are upset that it's completely distance learning.
So I think that's an important question for people to hear. So yes, I am on the record saying that the state should be providing the resources and they should be providing the guidance, and then we should encourage the school districts to follow that. And then when they do make those decisions, then the state should be supportive of those decisions on a local basis.
You had mentioned that you spoke with Governor Lamont. Was that today that you spoke with him?
Yes.
So what did, if you're able to go into the details of that conversation, they're getting, from Harvard, have gotten high marks on their vaccine rollout. Is there anything that you took from that conversation with Governor Lamont that you would like to replicate here in Rhode Island with what they're doing in Connecticut?
No, I think the question that was asked, we're heading in that direction. And that question was asked to me 2 weeks ago, whether I felt as though that we were. I knew these things were in the works. I know that the strong recommendations that I made are moving in that direction to get the vaccines out of inventory and into people's arms. My conversation with the governor is, as he's had a great relationship with Governor Raimondo, so I'm reaching out to all the New England governors at the moment, and participating in calls with the White House. So I think that we're headed in the right direction. We're building capacity right now. I did speak to him specifically about his strategy on the teachers, and we're going to follow back with that policy people to make sure that what we put out, makes sense, and that it's being embraced in Connecticut right now. And you can go online and see the details of what they're doing, but it was a good conversation with the governor, and we're going to keep those discussions going with our
strictly on the teacher side of it, though? It was strictly on the teacher side of it, where you're more interested in figuring out a good way to get teachers vaccinated, just picking
teachers, school personnel, remember the school personnel as well, and then also which we showed several weeks ago, a strategy on the child care as well. So that's encompassing and plans throughout the country. And I'm fortunate to have good networks national networks in education, and we'll be working with people. Our goal is in September to be using both testing and vaccination and education in terms of how we can make sure, the goal would be to have all our schools open and by September, and salvage as much of the year as we possibly can because of the lost learning, with a strategy that could get more and more teachers in the classrooms, more and more students physically in the buildings.
Lieutenant Governor, what are the metrics you're going to look for? I assume you're on board with the reopening of football and lacrosse. What metrics would you look for to shut down those sports? Because we've heard in the past, sports, especially men's lacrosse and football, that's a close contact as pretty much you can get besides wrestling. So what should people be looking for additional precautions, and what metrics would lead to a shutdown if we saw certain cases rising in those sectors?
Well, again, I think that the data and the science drives those decisions, and I have been saying that incrementally we should be creating more and more flexibility in every area, and the sports included. But the science would drive that. And so you would take a look, and I think that you can challenge people. This is what I was talking about, this 9/11 moment right now, to work with the municipalities, and that's why we're strongly reaching out to them. They have been a missing ingredient, and now added to what the state is doing. We're going to create this community type of buy-in, not only for being safe and doing safety strategies so that sports can open up. I see basketball games on TV. The kids got the masks on. I mean, there's ways that we can do this, and we should be looking for more and more ways to be flexible. But science will drive that. But I think that behavior does impact our numbers. And so when we talk about bringing municipal leaders in on the ground level, bringing civic engagement people that are doing Boys and Girls Club work or church work, and on and on and on. The list goes on and on and on. You got to, if you haven't visited one of the, visit the state site. I'm getting, my wife Susan went online like everybody else, and we're going to have a vaccination on Tuesday, I think, and we're going to wait with everybody there to get that done. But visit one of the municipal sites. I was in Barrington yesterday. It's almost there's a level of excitement there that people have come out of their homes, and now they're locally with their local leaders and the people who are working with them that you can't measure. That buy-in is going to let us get to the spaces that you just talked about, more and more flexibility, both in our businesses and in our civic and our music venues. Right, Newport right now is sitting on a big issue right now. What are we going to do in Newport for the Newport Festival right now? Certainly one of the things that I'm going to be working on when I'm governor.
And if I could just follow up to that point, in addition to high school sports, there's plenty of people right now, seniors, who are missing out on the opportunity to perform in drama clubs, in bands, choruses, do art shows, whether it's inside school programs or outside of school programs. What do you say to those kids right now as they watch their peers who are in contact sports resuming their activities while they're still unable to exercise their creativity?
Yeah, so I think that, again, that incremental flexibility is right on the list, and working with young people, as I've had my whole life, is high on that list. But again, science is going to drive that, right? Our infection rates, our hospitalization rates, and those type of things. But I think when we get this 9/11 moment and everybody in the state rallies around this enemy, that this virus, that the Dr. Alexander Scott, we had our first case on March 1st last year, and it's been a living hell, right? I mean, it has not been easy. And as Dr. Alexander Scott said, we're going to make it through. But the idea of the vaccinations, increasing our capacity, getting all hands on deck, including our municipal leaders, that's how we're going to get this done. And then we also got to worry about the acceptance to take the vaccine. At some point in time, we're going to have more vaccine than we need, and then we have to convince people to actually take that vaccination. We need to do everything we can, and that's certainly something that we're going to be working on, partnering in with the state, my office, and municipal leaders to get that message out broadly throughout every community.
Eric, go ahead. My question is, the season started on Monday with conditioning for football. I'm wondering if the change in power, did that cause a delay in making this announcement, and why wasn't it done sooner so the kids, when they started the season, would know, okay, we are going to play games, and what was the delay in making this decision?
Well, I'll let the Director Coit answer that question. These, again, I'm going to say it loud and clear for everybody out there. You have one governor, and I'm not the governor, but we are impacting significant change right now from where we sit. and we're partnering in with the team that's there right now. So, as I just answered, I believe in flexibility, incremental flexibility, and we need to take a look at that. And I understand there's some deadlines in terms of the equipment on football, but they're going to be, if that gets opened up, as I would expect that it would at some point in time for their fall season, they're going to have time to address that. I know it's not on their timetable right now that they want, but they'll have time.
You're likely going to be governor next week. Why have you not announced to your senior staff?
There's no reason. We're putting that together, and we've got to make sure that we do it well and professionally. And there's certain people that might be coming from other jobs that haven't notified their current employment. We're going to do it well. We'll have that announced before I take office.
And then a quick question. You mentioned 5 state sites. We've only talked about 4. Is the 5th one in the East Bay?
There's a 5th one in the planning stages right now, and that's something that, again, building the capacity, overbuilding the capacity in terms of anticipation of the vaccines is what we have to do, and that's why we're talking about those sites and regional municipal sites, and they're going to be strategically, those municipal regional sites are being selected now, and that we're going to make sure that it's very accessible around the state as we get into the 65 and under vaccinations.
Dr. Alexander Scott, can you explain the situation if the Johnson & Johnson vaccine is approved for emergency use? How many doses could the state receive possibly, and who will it be going to? Could this help homebound patients? Could this help people who are experiencing homelessness?
Thank you for that. With Johnson & Johnson, the FDA is meeting to make a final emergency use authorization decision on the vaccine, and that will be in the coming days. With credit to our vaccine subcommittee, they are prepared to come together quickly to help us assess and understand what the recommendations are and determine how to best apply that to our approach here in Rhode Island. Our federal partners have let us know that if the Johnson & Johnson vaccine gets approved, we would likely get a first push of 9,000 doses. We could conceivably start administering this vaccine in 2 weeks or so, provided that everything goes as expected with the national review and then the local review that I mentioned by our Rhode Island COVID-19 vaccine subcommittee and our leadership here.
Just a follow-up question to that. Some people are wondering, should I get Pfizer, should I get Moderna, should I get Johnson & Johnson? I mean, what's the difference for some?
Definitely work towards getting vaccinated, period. The difference may be in some of the data that has talked about the effectiveness and the 90% plus with the vaccines where it's 2 doses are administered, and slightly less with the Johnson & Johnson where it's 1 dose. There's further studying on how to help increase that effectiveness. We are very confident right now with saying overall getting vaccinated with any of the vaccines available. They've gone through their FDA process, overall improvement, and a thorough review here at the state level. They are safe. They are extremely effective, as we're showing with our decreases in hospitalizations, and it's a way to help protect your household. Testing, treatment, and vaccinations, we're still aiming for having a great summer here in Rhode Island.
Dr. Scott, and a very quick question for Secretary Pryor. Dr. Scott, what was the overall cost and maintenance, total out-of-pocket expenditures for the field hospitals, and how many patients did the field hospitals ultimately see at what level?
I can get back to you with those specific numbers.
We don't have any ballpark?
It's about 600 patients total at the 2 facilities, but I can get you the specific.
Fair enough. And Secretary Pryor, just a very quick question. Secretary Pryor, at this conference, myself and other members of the media have repeatedly asked you about businesses in Rhode Island that may be, because of the being literally shut down by the state for no reasons of their own, being in difficult stead with fines, fees, etc. Now we find out through the reporting of the Valley Breeze that North Smithfield is holding up 5 liquor licenses based on quote-unquote negotiations with the Department of Revenue and facing ultimate closure within 30 days. The Raimondo administration, I want to clarify that, has repeatedly said that they would look into, intervening in those efforts and also preventing, if you will, fines shutting down businesses. Clearly, that's not happening. Are you aware of this situation, and where else is this happening, as you should be aware of, across Rhode Island?
I'm not personally aware of that situation, Pat, and if we can, as a sidebar, I'd love to get more info and look into it.
Well, my follow-up question is, based on how often this subject has been presented to you in this forum, why aren't you aware of this situation?
The liquor license scenario that you described has not been presented to me personally in this forum that I'm aware of, but I'd be happy to get a sidebar and get the more information from you that you described.
Dr. Alexander Scott, you noted that the death data will lag and should also decrease, but the CDC has Rhode Island's death rate as the highest in the nation in the last week, and I believe still a majority of the deaths are at nursing homes. Can you explain why that still is, especially after the vaccination effort there?
Absolutely. Very sadly, but overall, our fatality data lags, as mentioned, cases and hospitalization data by several weeks. And we all know that Rhode Island here, we were hit very hard by COVID in December and into January, where we saw surge in cases. And some of the fatalities that are getting confirmed now are from people who got sick during that time. Our expectation is that our number of fatalities for February will have passed the peak and will start to drop given the decreases in cases that we are seeing now. And so we anticipate that those numbers will start to change.
Do you know why Rhode Island is the highest in the nation at that? I mean, apart from reporting issues and stuff like that, it is significantly higher.
Yeah, I would connect it to our case rate data as well, which also was high at some point. We, as everyone knows, lead the nation in testing with a more densely populated state and a high number of individuals who are of older ages at higher risk of both COVID and the consequences of COVID. We can tend to have higher case rates, which would ultimately play out, particularly with the larger proportion of our patients being older, in patients being hospitalized and subsequently dying in certain situations. That's exactly why, for our phase 1, we were laser focused on our community of long-term care, older individuals, and those who care for them. And so that likely contributed to why this lag is showing that our numbers are high. But over time, now that our vaccines are penetrating that community that we have focused on for phase 1, we expect to see it start to decline.
Just a quick question, Dr. Scott. The Wall Street Journal reported that no one that has received the vaccine has died from COVID. And I want to repeat that. No one that has received the vaccine has died from COVID. What are you hearing? What is the hesitation? Because I know Governor McKee mentioned then you have to convince people to get it. But just what are you hearing? And is it higher than you expected it to be? Because if we are following the science, it seems very clear that those that get the vaccine, you're not going to die from COVID.
So it's an important message to really encourage those who are questioning or are wondering, should they get vaccinated? We are starting to see here in Rhode Island as well that once someone is fully vaccinated, plus the additional 2 weeks it takes for them to really achieve full immunity, that deaths are no longer happening. And we are seeing in our nursing home fatalities, since we started vaccinating, that none of the people who have received both doses, followed by an additional 2 weeks, have passed away subsequent to that. So it is extremely effective. I know people that questioned wanted to wait and see what types of outcomes we would see. Here in Rhode Island, we are seeing what we anticipate, and it is encouragement. We have the capacity that as your time is available, go get vaccinated while continuing to get tested regularly and get treated if you qualify.
There was a report on I'm sorry, there was just a report on Channel 10 that there were many first responders that were not getting it. Can you see where that would be detrimental? People would expect a first responder would, almost have inside knowledge of this. Is this something that you're planning to address? Is there any excuse why first responders would not have the vaccine?
It's something we're absolutely focused on in helping to ensure anyone who has questions about getting vaccinated continues to be reassured and understands the effectiveness of the vaccine in keeping people out of the hospital and keeping them alive, and the importance of getting vaccinated for protecting themselves and their households.
Brandon, last question.
I just want to ask, we've heard about Secretary Pryor, we've heard about the better picture of cases, hospitalizations, and changes in sports. I'm just curious when we could see a change in restrictions either for restaurants, the event industry, some relaxing if the picture is as good as we're describing.
Governor Raimondo and Lieutenant Governor McKee have observed the same. They are asking us to seek more flexibility in industries where such flexibility is possible. We do have some additional news today on the issue of event professionals, which is that event professionals can, under the rules that will be established going into this coming weekend, coordinate events in residential settings. We had only permitted non-residential formal events such as weddings, so informal venues only. Now residential settings will be permitted with the same rules. So that means restaurant rules around spacing, no congregating, no mingling, and also testing of all participants at 50 maximum for weddings, 30 for other events. So those are well-orchestrated events in residential settings, not just dropping off food and having a backyard barbecue or other such gathering. Equally important, event professionals have asked us to look to the future enough that they can in fact plan as event planners. And in consultation with the newly arisen Event Professional Alliance and the Hospitality Association, we are able to say that by April, we expect that we will be able to expand events from the maximum of 30 for routine events and 50 for weddings to 100 indoors and to 150 outdoors. Now, I say that with gratitude to Dr. Alexander Scott. We've been able to express this as a prediction that by April we'll be able to open up more for event professionals in this way, for such formal events in this way. Of course, with Lieutenant Governor McKee and Dr. Alexander Scott, we're tracking the public health data so that if these new strains become predominant or there are other troubling trends, we may have to make revisions here. As just a final note, given that this is the anniversary of the arrival of COVID in Rhode Island, I just want to add gratitude to Governor Raimondo for her extraordinary leadership over this past year, and to Dr. Alexander Scott, and my thanks to Lieutenant Governor McKee and the new blended team that is with such strength leading this effort, including new flexibility around these rules. Thank you.